You be depressed and happy at the same time? Huh? Well, that's a question you certainly don't get asked every day.
Dr. Frieda Birnbaum is with us on the Kogo News Live Line. She is a research psychologist, psychoanalyst, and author. And Dr. Birnbaum, there was a study about how some of our kids are more depressed than previous generations. How do you explain that?
Well, we have so many things trying to make us happy with this new technology. We are immersed in other things besides connecting to people. And studies have shown that connecting to others is really where the happiness is. And we're lacking in nature, we're lacking in communicating with other people, and so that's going to get you down. And it's sad that we're going in that direction.
Well, kids these days, I hate to use a trope there, but I can't resist, they don't really talk to each other face to face. It seems like they always are texting each other and FaceTiming and stuff, but without that personal one-on-one experience, does that lack actually translate into depression?
Well, they don't even live as long. This new generation may not live as long as their parents, and that's very scary. When you're involved in people, when you're involved with experiences, it gives you the feeling of moving forward. Physical behavior is so important. Being active, this generation is more obese than other generations because of this as well. So we really have issues to look into and determine how we can make changes.
Well, so is depression, though, just a part of life that they have to deal with?
Depression is a part of everyone's life. Happiness is a fleeting moment, and the problem is that people get depressed because they think they're supposed to be happy all the time. And as you know, it's not possible, and contentment is a better word. That is something that's more obtainable, because in life things get in the way, events, experiences, people, and then they just go ahead and push you in another direction. But it's important to have a path to look at and say, you know what, this is my comfort level, and to get back onto that level as quickly as possible. And if you can do that, you'll prevent depression.
Research psychologist, psychoanalyst, and author Dr. Frieda Birnbaum with us on the Kogo News Live Line. And one of the things that they found in the research in these studies, one very particularly just last year, said that the trend is magnified in females. Girls are more than twice as likely as boys to have clinical depression. What is behind that?
Well, what's behind that is that it's not mental. This is medical. So people confuse that with a will, and it's not always in your control. So females in general have lower serotonin levels, and these levels can be increased with physical exercise, with being productive. They say that giving is something that increases your serotonin level. Your heart even beats differently when you're more outwardly bound. And females in particular are more inwardly bound, and that's not good because you're too immersed in your own feelings, and being involved with other people and having that kind of connectedness and compassion is what takes you away from yourself, and that's the best place to be in.
Doctor, I have a question. It just kind of occurred to me. Prozac came out in the late 80s. People started taking it. It was a new way to fight depression. And then a lot of people started taking antidepressants, various antidepressants, starting probably in the late 80s, early 90s. Are these kids seeing maybe what their parents are taking and saying, well, yeah, I'm depressed too?
Well, that's a very good question. It used to be women who had anxiety and the doctors would give them Valium or a good feeling pill, and then that would be it. Today people are questioning what it is that makes them feel good. They're questioning life and getting as much as they want because we do have more free time than we ever have had. And so we want more. But the problem with that is our expectations are so high that we're disappointed. And when we're disappointed, we don't know where to go. Psychiatrists are taught to give medication, and that's not the real answer. You're right. The real answer is to be out there and to give to society, to have a sense of being productive, to use your energy because that gives you more energy, and just to have a joy of giving to others. That's really where the whole process of happiness is.
Making Dr. Birnbaum, what the parents need to do is perhaps teach their kids from a very early age how to volunteer and how to give back. Listen, thank you so much for joining us. We really appreciate it.
My pleasure.